Hello, this is Lowell City Manager Eileen Donoghue. As the local circumstances related to coronavirus and its spread evolve rapidly, and the number of confirmed cases continues to climb steadily both in Lowell and across Massachusetts, I would like to provide an update on the efforts being undertaken by the city to respond to this crisis and the host of extraordinary challenges it has presented. The health department has been closely monitoring coronavirus since January as reported cases began to climb around the globe and has engaged in extensive efforts to ensure the city's preparedness in coordination with local health partners, including Lowell General Hospital, Trinity EMS, and the Lowell Community Health Center. The health department has worked closely with DPH and has participated in conference calls with the CDC to ensure that the city's response and preparation efforts meet all state and federal guidelines. In recent weeks, the city's Emergency Operation Committee, comprised of myself and staff from my office, Chief Winward, Chief Richardson, Joanne Keegan, Christine O'Connor, and George Rose, has been meeting daily to review developments related to the spread of coronavirus and to consider the implementation of additional measures. As a municipality, we are on the front lines of confronting this crisis. While grappling with the unfamiliar challenges that have been posed by the coronavirus, we have prioritized maintaining essential services to residents without disruption amidst shifting circumstances. And I want to thank the Lowell City Council for their unconditional support of these efforts and for their leadership in these difficult times. As of today, March 27, 2020, there have been 40 confirmed cases in the City of Lowell. According to the Massachusetts Department of Public Health, as of 4 p.m. March 26, 2020, there have been 2,417 confirmed cases across the Commonwealth. We expect to see this number continue to increase over the next several days as a result of local transmission, but also as a result of increased testing capacity that many entities are working hard to deliver. While the current number of confirmed cases in Lowell and in Massachusetts may not be comprehensive given the limitation on testing that is being seen across the country, they clearly indicate the heightened threat associated with transmission of coronavirus locally and underscore the importance of adhering to recommended precautions, including social distancing, which means remaining out of congregate settings, avoiding contact with others unless absolutely necessary, and maintaining a distance of 6 feet from others when you must venture out. Be alert to symptoms of coronavirus, which include fever, cough, and shortness of breath. Stay at home at all costs if you are experiencing these symptoms, and contact your primary care physician for guidance. We know that these measures are difficult and for many will lead to economic hardship, but they will have the collective impact of flattening the curve and will help ensure that the extent of this virus and spread remains within the capacity of our healthcare system. Lowell General Hospital has worked tirelessly in order to expand its testing and treatment capacity in preparation of a local outbreak of coronavirus. We know, based on information that the hospital has announced, that they have identified additional ICU space to prepare for a potential influx of patients requiring critical care. While confronting the shortage of testing supplies seen around the nation, Lowell General has implemented several measures to expand its testing capacity. In the past week, a drive-through testing system was opened at the hospital's main campus. Through its partnership with Tufts, Lowell General has been able to reduce the wait time for a result to be produced after testing. Meanwhile, the state is working hard to deliver additional testing supplies and through partnering with commercial labs has significantly expanded the state's testing capacity. As I noted, increasing testing will lead to an increase in confirmed cases. This data will be essential in conducting the kind of tracking of the virus that will be needed to overcome this public health crisis. Any individual that is demonstrating symptoms and believes they should be tested should contact their PCP, who will conduct an evaluation and offer a referral in cases where testing is appropriate. Individuals that do not have a PCP may contact the Lowell Community Health Center, which has implemented a system to screen patients to determine if testing is appropriate. It is critical to remember that anyone who is symptomatic should remain in quarantine through the duration of this process and not leave their home until a negative test is produced. As I mentioned, the Lowell Health Department is the primary entity overseeing the city's response to coronavirus. I would like to commend the efforts of Interim Health Director Joanne Keegan and her team in confronting the unforeseen challenges that have come their way in the last several weeks. Again, there are 40 confirmed cases of coronavirus among Lowell residents, and that number is increasing steadily. The health department is notified of each confirmed case by the Mass DPH. It then has the responsibility of investigating each case and notifying individuals who may have encountered the patient in a setting that would lead to transmission. The city was notified of its first positive case on March 15, 2020. The health department has handled each case since according to stringent protocol ordered by the Mass DPH and the CDC. For privacy reasons, the information that the city can disclose about each case is limited. However, we know that the virus has infected individuals from all neighborhoods, of all ages and backgrounds, further emphasizing the need for heightened precautions. The city is observing and enforcing all guidelines recommended by the state officials aimed at reducing the spread of the virus. Schools closed in Lowell as of Monday, March 16th, and this week, Governor Baker ordered all schools in Massachusetts to remain closed until May 4th. City Hall closed to the public as of March 16th, and in-person workforce reduced to essential employees only as of March 23rd. Our focus has been on maintaining continuity of essential services while protecting health and safety of the organization. On Monday, Governor Baker ordered the closure of all non-essential businesses effective March 24th at noon until April 7th, 2020, paired with an advisory for Massachusetts residents to remain at home from the Department of Public Health. Inspectional services and the police department are working to ensure that this order is observed in Lowell. We are acutely aware of the risks that this public health crisis poses to first responders, as demonstrated by outbreaks within police and fire departments seen across the country. The circumstances of their work pose distinct risks for exposure. Police and fire have implemented measures to reduce exposure to patients with flu virus symptoms. Dispatchers have enhanced script to screen situations to determine if coronavirus-like symptoms are present. We will continue to do all that we can to protect the health of first responders who are so crucial, particularly during this time of crisis. I want to acknowledge the economic turmoil that this crisis has created for many in our community, individuals and businesses across the economic spectrum. The city's Economic Development Office has been working to compile resources for impacted business. We know this task will continue long after the resolution of this public health crisis, and we are committed to doing our part in coordinating with the state and federal government to aid in the recovery of all who have been impacted. The city is committed to providing timely and up-to-date information about the coronavirus to residents. lowellma.gov/coronavirus is updated daily and includes updated counts of confirmed cases in the city. Updates are also frequently shared through the city's Facebook and Twitter pages as well. Residents are encouraged to sign up for emergency updates through code RED, which you can do by visiting lowellma.gov/code RED. The city has also activated its Emergency Operations Center, which serves to assist Lowell residents in situations related to coronavirus and to provide immediate responses to inquiries related to the situation. The EOC is operational 8:30 a.m. to 4:30 p.m. Monday through Friday until further notice. The EOC can be reached by phone at 978-674-4052. In closing, I want to express my gratitude to every person in the Lowell community who has been on the front lines of responding to coronavirus, from doctors, nurses, and first responders to grocery store workers and the countless others who have had to adapt to shifting circumstances to provide vital services to our community. The spirit and the strength of the City of Lowell has been on display throughout this crisis. There have been countless demonstrations of goodwill and instances of individuals and organizations stepping up to support the collective well-being of the community. In the past week, Greater Lowell Technical High School and Maycom, among many others, have responded to the call for personal protective equipment and have generously donated supplies of face masks and other equipment to the Lowell General and to the city. As the uncertainty of this crisis has brought to our lives persists, these acts of compassion and generosity can make us all hopeful that we will get through these difficult times together. Thank you.